Hi, people. Hope you're all doing good. In today's topic, let's talk about a very important organ known as the heart. Heart is basically a thing which doctors should know, right? Why should I know? I'm not a doctor. Of course, yes, we aren't doctors and we are not going to save anybody. But should we know about heart? Yes, because there are certain things which we should know about as a general knowledge, which at some point of time is going to help us in some way. To know about heart, we have to know about how it functions. Though not core deep inside how it is functioning, we must know the basics so that we can find out what if bad happens like heart attack or anything, and what are all the precautions to be done at such scenarios so that we can increase the possibility of saving a life. So in our channel today, let's talk about some important facts and knowledge, and let's learn together. Heart is a muscular organ which can be compared to a motor. Like how motor keeps on pumping water to every part of the area, heart is also functioning the same way. Heart pumps the blood to the every part of the cell from top to bottom. So how does that function? It has been said that heart has 4 chambers anatomically. On the right side we have 2 chambers, and the left side we have the 2 chambers. Those 2 chambers on the right side, it is called as the right heart, and the 2 chambers on the left side is called as the left heart. So heart is basically a single organ which is split into 2, physiologically and anatomically. Physiologically, the right side of the heart is considered to be carrying the impure blood. What is impure blood? Impure blood is the blood which comes from our body after utilizing the oxygen. So those impure deoxygenated blood comes to the right side of the heart. From the right side of the heart, the blood goes into the lung. The impure blood from the right heart now reaches the lung, and via breathing we will take in the fresh oxygen, and that oxygen will be mixing with this impure blood and makes the blood again oxygenated, which is called as the pure blood or oxygenated blood. After getting oxygenated, this oxygenated blood from the lung will again go into the left side of the heart, or known as left heart, where we have 2 chambers. From the left side of the heart, that pure blood goes into supply for every part of the body, including from head to toe. So this is how a heart functions, and this is how a heart will oxygenate our blood. Okay, so what is heart attack? What are all the causes for heart attack? Knowing the causes for heart attack, we must know what is heart attack. It can be understood by a simple theory which we used to see in a day-to-day life. Usually drainage pipe, if gets clogged or anything, the outlet will be blocked, so the water won't be going that side. Same way, inside our body we have multiple blood vessels, and each blood vessel's purpose is to supply a cell or tissue. If that blood vessels get obstructed or got clogged because of cholesterol or any other thing like sugar, then the blood supply will be deprived. So the particular cell or tissue to which that blood supply is being done, that cell or tissue won't be getting any blood. That is called as ischemic state. So ischemia is nothing but a blood deprived state where the cell or tissue won't be receiving any blood. So what will happen? Obviously that cell or tissue will die. Same thing is happening to the heart. Even though heart is the pump or the motor which is pumping the blood all over to the body, that motor also requires some amount of energy, right? That energy is supplied through a vessel known as coronary artery. That coronary artery is the artery which supplies the blood to the heart. If that coronary arteries get clogged, obviously the blood won't be going into the heart muscle. So heart cells will go into state of blood deprivation, which is known as ischemia, which we call as heart attack. So this is the generalized outline to know about heart attack. So what are all the symptoms that heart attack patients will have? They will either show symptoms in the face mostly. Their face will be showing sweating and lot of palpitation and tremors. It is called as that fear of doom. Usually the patient won't be feeling any chest pain until it is the terminal stage. So at that terminal phase, when we take that patient to the hospital, the chances of saving that life will be very low. That is where basic knowledge about heart and heart attack to the general population will help save a life. Because if we know about some knowledge or clue about heart attack and the symptoms shown by the patient, we can take that patient immediately to the hospital without wasting any time. So before knowing that, I want to share a very important thing known as golden period of heart. So what is that golden period? Golden period is the period where the blood deprivation state of heart starts to the point of no return. To the point of no return means after that golden period, we can't reverse the changes which happened in that period of time. That is why it is called as golden period. So golden period is around 20 to 40 minutes, and if we take an average, it will be around 30 minutes. It is always better to take the patient within that golden period, and we have to some way try to recover during that golden period. If we miss that golden period, the chances of patient surviving will be very low, and even if he survives, the changes and the damage which happen to the heart will be irreversible. So it is always mandatory to save the patient before the patient's golden period get finished off. Okay, today we have learnt about how a heart basically functions, what is heart attack, and what is the golden period. With our next video, let's talk about the core things like what are all the causes for heart attack, and as a general human population, how we have to identify the heart attack prior using basic symptoms, and how we can do household remedies before reaching the hospital or ambulance, which can save a life. If you like my video, please do help me by liking, sharing, and subscribing to my channel. Thank you.